but it could also be, at that point, it could be so many other diseases like malaria, like typhoid fever. So once the person starts having high-grade fever and all those symptoms, is able to transmit the virus, because at that point in time, the virus is already in the blood. At the period where we refer to as viremia. So the viruses are already in the blood, and so the person can transmit the virus.
Okay, it's been reported that 10% may survive an attack, that Ebola kills about 90%. I want to also look at the 10%. Why are these 10% surviving? What's different about them? Is it the care? What is it? Or is it a combination of factors?
Well, I must say it's not just 10%, at least from the current reports.
Well, they say it's at 60% yes, fatality rate now.
So that means
we should be happy,
now
shouldn't we?
It's about 40%.
So about 40% are surviving.
Yes.
What is tiding this 40% or so over?
It may be a combination of factors, but we cannot say exactly why some people survive, why other people do not survive. It might be the viral load, it might be the person's immunity, but we can't say exactly why some people survive and others do not survive. But it's important that the patient presents early. If he presents early, it's likely he may be able to survive, but we can't say why. But all these factors, early presentation, if the load of the virus, those are the things that determine whether the patient will survive or not.
Okay. Ebola has a lot of complications. You know, we've heard of the liver packing up, you know, shutting down of systems, other things. Is it the Ebola itself that actually kills the patient, or some of these complications? What really makes the patient give up? Because, you know, there are some sicknesses that, I'm trying to make you understand why I'm asking. There are some sicknesses that sometimes they don't have a cure, sometimes they do, but they tell you that what they do to support the patient while going through the sickness is what actually keeps the patient alive, like rehydration and other things. So I want to know, what really is the complication that is the clincher? What kills the patient?
Well, it's usually at the end point, there is multiple organ failure.
Okay.
The liver packs, the kidney packs. So once there's multiple organ failure, it may result in death. The patient also bleeds. It could also bleed to death. So at the end of the day, it is the multiple organ failure that kills the patient.
We've had a couple of health workers who died, got infected while caring for other patients. They were supposed to be suited up and everything. What could have gone wrong? Because, you know, it was quite a shake-up for people to hear that the people who were actually caring for the sufferers got infected and actually died. What could have gone wrong in the care, in the chain of care and treatment?
There must have been a breakdown somewhere, because once even when you wear all the protective gears, the gloves, the mask, the goggles, you must also make sure that once you remove all those things, you should not make contact with the soiled materials. The soiled gown, the soiled gloves, you must do your hand washing. So it's
okay. So it could have been something other than maybe a tear in their clothes.
Yes, maybe when they remove their clothing and they got soiled. So many things could have happened, but I can't really say, because I also have thought, why would they, with all the protective gear, get infected? But there must have been a breakdown in infection control measures somewhere along the line.
Now, there's been a lot of talk recently. I just want to clear this up. Lots of people are saying that bitter kola has some curative properties for Ebola, you know, and then there's some sort of leaf somewhere that if people take it, they will get better or they will get okay. Just clear the air now. Does Ebola have a cure?
There is no cure.
So what we're hearing are just rumors.
There is no scientific evidence to corroborate whatever rumors we're hearing.
What do you think, or do you know for sure? Why haven't we got a vaccine yet? Is it that we have not seen the need until now, or it has just eluded medical personnel?
Yeah, vaccines have been made, but they've not been able to get a successful vaccine candidate to be able to use.
Okay. Now, when those people who recover from Ebola, when they recover, well, it's about 40% now, that's good news. When they recover, can they still infect someone else right after recovery?
Before,
maybe through breast milk or, something like that?
yes, before they are discharged, it must be confirmed that they are no more infectious, especially with the blood. Once the blood will be taken and checked whether there's still Ebola virus within the system. What has also been known is we advise men that have recovered not to engage in sexual intercourse, because it found even after 2 to 3 months that the virus is still present within the semen. So the person should abstain, and if you cannot abstain, should use condoms to protect. But abstinence will be better.
Okay.
But before they are discharged, it is important that the patient, it will be important that the hospital will ensure that the patient will not transmit the virus once it's discharged. That is.
But what about breast milk?
Well, they will have to test everything. They test and make sure everything is fine. And advise, yes, accordingly.
Okay. Now let's talk about burials. Now it's sometimes people don't know what somebody dies of anymore. How should burials be handled?
If someone dies unexplainably, if it cannot be explained how someone died, and he didn't die in the hospital, we should call the relevant authorities and inform them so that they can be able to dispose that body safely.
And not touch you. Don't touch the body. You just call.
Yes, you just call. Because ideally, if a patient is sick, he should have presented at the hospital. And if he dies in the hospital authorities know exactly what to do, how to dispose of the bodies.
We're going to take a break right now. We'll take a break at this point. When we come back, we'll interact with phone calls. Welcome back. The number to call is 012206-842. That's 012206-842. Call in, ask your questions, or give us your contributions. Tell us about your fears or your experiences while we continue with the discussion. Now let's talk about meat. Since animals have been fingered in this matter, should people stop eating bushmeat?
Yeah. The animals that have been found to cause this kind of ill, that are infected, that may transmit infection, are usually wild animals in the forest. So any animal that is caught in the forest may be a potential may have the potential to transmit if it's infected. And sometimes these animals are dead when they pick them. We don't know. So it's usually the first case usually is someone who, usually an hunter or someone who goes to the forest and picks up a live dead carcass or kills an animal that's already infected. So we do not know the source of this bushmeat. So that's why people have been told don't eat bushmeat. So it is meat that is from animals in the forest that are usually
not
antelopes.
Our regular meat.
No, but even antelopes, apes, baboons, monkeys, and you are even told not to, at this period not to play with baboons and monkeys because they could also be infected.
Okay, so that brings us to control. Let me give an example. Lassa fever is caused by rats.
Yes.
The response to that would be, look, try and rid your house of rats, fumigate or whatever it is they do to kill rats and all that stuff, keep your doors shut and all that. Is there any control measure for these animals to sort of increase the distance between them and humans?
Well, these animals are supposed to be in the forest. They are wild animals. And if it is the ones that are domesticated, they are not supposed to be out in the open.
Okay.
So they're not supposed to be out in the open. We're not supposed to be making contact with monkeys on the streets, monkeys around, or baboons or apes. So we don't see them around. So it's people who go looking for them.
Okay.
Yes.
Okay.
So it's not like the rats that are within our
coming to the home.
Yes. These ones don't come to the home. We are the ones that bring them in if we do. So that's the difference.
That's food for thought. Now, talking about decontamination, kudos to the private hospital where our only case was taken to. they quarantined him and did a very good job of it. But there's been so much talk about they're decontaminating the place, and when it's okay, they're going to tell the public, and they're going to open it according to WHO standards. What is the standard for decontaminating a place? You know, I would have thought that, you know, you just wash down the place, maybe with some disinfected water or something with a chemical in it, and you're good for business.
Yes, they would have to decontaminate. They would decontaminate.
How long is this supposed to take?
Well, you know, it depends on how big the premises is, and they also need to go round all the premises to decontaminate. And of course, you also know that they need to make sure that all those who were contacts of this patient in the hospital are also quarantined and watched over the next 3 weeks. So we need to give that time to make sure that even those who could have been infected in the hospital are also looked at and be sure that they didn't contact Ebola. So it takes some time to do that.
I'm afraid we're going to have to close the program at this point. It's been Health Matters, and we're going on for a live coverage of NMPCs, a World NMPC press conference by Desiani Alison Madrike from the NNPC headquarters, Abuja. Now on to the live program. Thanks for being with us. It's been Health Matters.